And today we'll be talking about cancer in children, childhood cancers, or pediatric cancers. My name is Dr. Anantai. Pediatric cancers or childhood cancers is a term, is a general term given to a range of cancerous and non-cancerous tumors found in children. And approximately 300,000 children are diagnosed with cancer every year. And though it's a rare cause of illness, it's a leading cause of death worldwide. The exact cause of cancer is unknown. However, science and research has shown that it could be from a cell mutation. For the childhood cancers, we have the leukemia, the lymphoma, retinoblastoma, and other blood cancers. Amongst them are the three commonest. We have the leukemia, accounting for 25 to 30% of the cancers. And then we have the brain tumors, also about 25%. Then the lipomas. Leukemia is a kind of blood cancer that starts in the bone marrow or blood tissue, blood producing tissues. And they also account for one out of three cancers. The commonest types are the acute lymphatic leukemia, and that is the ALL, and acute myeloid leukemia. Whilst the acute lymphatic leukemia tends to peak around the ages of 2 to 5, the acute myeloid leukemia would usually be diagnosed in the first 2 years or somewhere in the teenage. And the second commonest is the brain tumor. The brain tumor is a collection of abnormal cells that form in the brain, and they could be benign or malignant, and they are also different from those that are seen in adulthood. We have the gliomas, the medulloblastomas, and the age is dependent on the kind of cancer that is seen. So we have the gliomas around the 5 to 8 years, and then medulloblastomas around 0 to 4 years, so under 4 years. And some of them, we see them peaking in the 5 to 8 years.
Hello everybody, my name is Dr. Victoria Maniela and I am a member of the International Christian Medical Fellowship. And today I'm here to talk about the symptoms and signs of the most common childhood cancers. So before we begin, I would like to differentiate between symptoms and signs. So symptoms are usually what the patient is feeling, what they report to the doctors. So usually we call this subjective. And signs are what the doctor or the examiner notices in the patient, usually during the physical examination. So these are objective. So as we are going through today's topic and presentation, I'd like you to keep these two things in mind so you will be able to know the difference and understand the presentation. So let's get started. So over here we have a chart that is showing the most common childhood cancers. This is in the year 2016 over the age of 0 to 14. So on the top, we have leukemias, we have brain and spinal cord, or we call them central nervous system tumors, CNS for short. We have lymphomas and etc. There's also bone tumors somewhere in the list. So I picked out these diagrams to show us the various cancers throughout the years, and then I will tell you what 3 cancers that we'll be discussing today in our presentation. So over here we have another list in 2019. We're going to talk about today. Okay, and so finally in today's discussion, the report in 2021, we are going to be talking about 3 common children. That is leukemias, CNS tumors, and lymphomas. So before we begin, I'd like to differentiate between leukemias and lymphomas. So leukemias are usually the stem cells in the bone, originate from the stem cells in the bone marrow. Usually the most common one are the white blood cells tumors. And lymphomas originate from the lymph nodes. We have cervical lymph nodes, we have bronchial lymph nodes, we have lymph nodes all over our body that protect us from invasions of infections and etc. So let's get started. So first off, we're going to talk about the signs and symptoms of leukemia in children. So like I said before, symptoms patient feels, and signs the doctor notices. So some signs that a doctor could notice in a patient could be pallor, they're pale, they're tired, shortness of breath, or they're bleeding, and etc. So some of these symptoms that I'm going to be talking about can also be signs at the same time. So they might experience frequent infections, bruising and bleeding. They might feel unwell. They're extremely tired. They have headaches. They have no appetite to eat. Sometimes they could also complain of stomach aches, which could be because of the swollen liver or spleen that presses onto the stomach. So your child may complain of a stomach ache, bone or joint pain, and etc. Here is a better diagram to kind of summarize what I just talked about. So if you'll notice that some of these symptoms don't always necessarily mean that it is a leukemia. Some of them could be what we call unspecific. But why do we spread awareness is so that if your child is experiencing any of these symptoms, that you will go see your primary care physician or doctor so that you can make sure that your child is doing well and that they are safe. Okay, so now we're going to move on to CNS tumors, or we call them brain and spinal cord tumors. So some symptoms could be seizures or headaches. They could be having a blurred vision because maybe the tumor is pressing on their optic chiasm, which is responsible for our vision. They could also be having nausea and vomiting. Headaches are common, sleep disturbances, and etc. Again, these symptoms are not always specific to a brain tumor. They could also be unspecific. But why we spread awareness is so that if your child is experiencing any of these symptoms again, please do see a doctor. But these are the 10 most common symptoms of brain cancers in children that we are here to talk about. So, and finally, we're going to be looking at lymphomas. So some symptoms and signs of lymphomas in children could be a fever with no non-cause. They are not having an infection. They have been doing well, but they're just having a fever all the time. Also, unexplained weight loss. And one more common one is this fatigue. Unusual fatigue. You could have a child who is very active, very involved in sports, but they're always tired all of a sudden. And also swollen lymph nodes. As we did say that lymphoma originates from the cells in the lymph nodes, so it is not surprising to have the lymph nodes being swollen. So these are some of the symptoms of lymphomas to look out for in your children. Again, as I said, they are not always specific, but they could be unspecific. But if you see more than one of these symptoms consecutively in your child, is best to go and see a doctor as soon as possible. And here is my last chart to show more of the lymphoma symptoms. We have, again, swollen lymph nodes, fatigue, weight loss, itchy skin, night sweats, and etc. So thank you for coming to today's presentation, and I hope that this awareness has been useful, and thank you.
The majority of childhood cancers, I believe, to arise as a result of gene abnormalities that cause excessive cell development and later cancers. A lot of tests are carried out by doctors to diagnose cancer. They do these tests to determine if the cancer has spread to another part of the from where it started. The doctors may also do tests to know which treatments might work best. And for most types of cancer, a biopsy is the only way for the doctor to know if an area of the body has cancer. The doctor takes a small sample of tumor tissue for testing in the laboratory during a biopsy. A doctor may also suggest other tests that will help make a diagnosis if a biopsy is not possible. There are many tests used to diagnose childhood cancer. There are factors that doctors consider when choosing a diagnostic test for a child: the type of cancer suspected, the child's signs and symptoms, the child's age and general health, the results of earlier medical tests. In diagnosing and treating children with cancer, a physical examination and the following tests may be used to diagnose childhood cancer. Blood tests. With the blood test, it measures the number of different types of cells in a person's blood, because the level of certain cells that are too high or too low can indicate the presence of certain types of cancer. Biopsy. For biopsy, a small amount of tissue is removed for examination under a microscope. Other tests can suggest that cancer is present, but only a biopsy can make a definite diagnosis. Bone marrow aspiration and biopsy. These two procedures are similar and are done at the same time to examine the bone marrow, which is the spongy fatty tissue found inside the longer bones. You can also carry out a lumbar puncture examination. Ultrasound is also done. A computer tomography is also done. You can call it the CT scan or a CAT scan, that is CAT. And a positron emission tomography is also done. For short, you can call it the PET scan or the PET CT scan. And a scan can also be done. So for the scan, in the procedure, a trace is injected into the body, and this study can find abnormalities in the liver, the brain, the bones, kidneys, and other organs. Most of these tests may be repeated during and after the child's treatment to find out how effective the treatment is working. So when the diagnostic tests are done, the doctor will review the results. So if the diagnosis is cancer, these results will help the doctor to describe the type of cancer. This is called staging.
Hello, and my name is Dr. Augustine K. Bala, and I'm visionary of the International Christian Medical Fellowship. So we are joining the medical teams around the world as we talk about cancer this month, creating awareness of cancer, especially cancer in children. And so our team at ICMFEL this month, we decided to put out this video as part of activities to medical education and encourage and challenge people to pay attention to their health. That's value. That's one of the important things God has given us health. He's given us wisdom to also be able to maintain and keep ourselves healthy. And so I'm going to be joining my colleagues who have talked about the different topics related to cancer in children. I'm going to be talking about screening in children. So when we talk about screening, screening is actually a test for a disease such as cancer in people who don't have any symptoms. So, well, they may not have any symptoms, they are not diagnosed yet of the disease, but we run a different test, we checking to make sure that they do not have that disease. So that's what screening is. And so, yes, you still be able to look out for symptoms and some symptoms that is not specific to that disease, but you are running a test because that population is at risk, or that population have the possibility of having that disease as symptoms. And so for children, usually parents need to be aware that there are symptoms that are not specific to cancer, but if you see these symptoms, you want to make sure the child is screened properly. Make sure you see your doctor to make sure that this child doesn't have cancer. And these symptoms I'm going to mention, these signs and symptoms I'm going to mention, they are not specific to cancer in children. They are symptoms that could most of the time be as a result of different sickness. But yes, parents need to know that it could also be as a result of cancer. So it's good for your child to be screened for cancer. And it's good that if they have any of these non-specific symptoms or some, even they should be an alarm for you to make sure that you screen for childhood cancer. So let's say some of the signs and symptoms that are non-specific, but they could be red flag, for which you want to make sure your child is properly screened for childhood cancer is if they have unusual lumps or swelling anywhere in part of the body, if they have unexplained paleness and loss of energy, if they have easy bruise or easy to bleed, or if they have pain in any part of the body that you cannot explain why, or they have unexplained fever and ailment that doesn't go up easily, they have frequent headache associated with vomiting, or they have sudden loss of vision, or sudden unexplained loss. These are signs and symptoms that should also um, kind of be a red flag for you to make sure your child is screened for childhood cancer. Again, like I said, these are non-specific signs and symptoms of cancer, and screening is actually a test that is done for people or for people who don't have any symptoms for the disease, but just to make sure they don't have that disease. And one of my colleagues talked about a different type of cancer in childhood or the common type of cancer in childhood. I'm going to mention that again and give the percentage because that will help to give you an idea as to why screening is very important for children, especially for childhood cancer. So, because children are risks of this kind of cancer, it's very important that if they have any of the symptoms or not, they should be screened for childhood cancer. Margin 28% leukemia, 26% uh, brain and spinal cord tumor. That's very high. So every child should be screened for childhood tumor. Early diagnosis will help early treatment in our child life will be safe. Thank you for following up. We hope that this awareness is a blessing to you and God bless you.
Hi, everybody. So I'm Dr. Faustin. I'm currently working in China as a master degree candidate in the Department of Cardiology. Right now, I'm going to talk about the diverse treatment of the most common type of childhood cancer. So I'm just going to focus on three main type of cancer, just like the one who spoke before me, Dr. Victoria, just said. The first one, I'm going to talk about ALL, which is acute lymphoblastic leukemia. And the second one, I'm going to talk about the lymphoma. And the third one, I'm going to talk about the CNS, or central nervous system type of cancer, how to treat them. So, in a nutshell, if you forget anything I'm saying today, just make sure to remember that the main way we treat these type of cancer is chemotherapy, chemotherapy, and chemotherapy. That's in a nutshell. Then we have diverse ways and everything. So in a nutshell, as I was saying, to define what is a chemotherapy, chemotherapy is we actually use drugs, we give that to the patient, and those drugs go and target fast dividing cells. What is a fast dividing cells, you're going to ask me? Fast dividing cells are cells that actually divide faster. Like from one cell into two cell, into four cell, into 8 cell, they do it fast compared to other cells. Example of fast dividing cells, yes, you guess it. Hair, they are fast dividing cells. Red blood cell, they are fast dividing cells. So cancer cells, no matter where they're from, they are also fast dividing cells. That's why we call them cancer, because they're dividing uncontrollably. They're not controlled, they just divide fast. So what is good is ALL is a cancer within the blood, so it's way easier for us to treat it by just destroying it with those drugs that we have. So when we give it into the three phase. We give the chemotherapy into three phase. The first one is we wait for the patient to go into consolidation. We do consolidation, that's the first one. We give a lot of drugs to make sure that the patient, the cancer cell are destroyed. After consolidation, we have remission, when the patient is on remission and everything. And then after that, we have maintenance, where we'll make sure that we maintain a low dose of treatment, a low dose of drugs to make sure that the cancer does not come back. And if you look around, ALL is the most common, but it's also the most commonly treated, and most of the patients get better. And what we do is, if the patient relapse or gets sick again, what we do, there's other ways we can use, like immunotherapy. We can also use stem cell transplant, although it's lessly used nowadays. But yes, stem cell transplant is like we kill all the cell of the patient. We do radiation therapy, so the patient will be without any red blood cell or any cell that produce red blood cell and white blood cell. So what we do, we give them stem cell. That is the cell that produce red blood cell and white blood cell. We give them those stem cells so they will have like a renewed cell in the blood and the system. So now that I talk about ALL, lymphoma, we have Hodgkin lymphoma and non-Hodgkin lymphoma. I'm not here to talk about the diverse type. The people who came before me already did that. So what I'm going to talk about is the treatment. For all the type of lymphoma, the main way to treat is also chemotherapy. But then for non-Hodgkin lymphoma, which is the most common seen in kids, what we do is we look, if it is big, if it is resectable by surgery, we do surgery, then we do chemotherapy. And you have an example or instance like Burkitt lymphoma, which is because of EBV in some patients, in some kids, especially in African American and most African kids. The lymphoma is usually Burkitt lymphoma. So what we do surgery, and so we add some drugs. And lastly, I'm also going to talk about the CNS type. CNS is very complex. It's the brain and spinal cord and everything. So the type of cancer that can come from there, though they be rare, but when they come, it's really bad. But then as doctor, we have to find a way to treat it. We find a way to, make it better. So the main way to treat it for CNS at least is surgery. If it is resectable, we cut it. We do it. So we cut it and we give the drugs, the chemotherapy, and the radiation in some instance. So yeah, that's it. And before I end, I just want to remind you guys that every time a child has ALL, acute lymphoblastic leukemia, and we need to give chemotherapy in CNS or in the testis, we have to make sure to watch out for the consequence such as infertility. So in some hospital, they will actually take out of the kid young health, they can give radiation or chemotherapy. So they have sperm that so yeah, this is what I had to say. Thank you for sticking with us. Thank you for listening to us. Bless you, and stay blessed and be careful. Always watch out. Take care of the loved one.